we are really excited today because we have two amazing speakers joining us today, Stephanie Brenden and Martin Yanushev, for our first session of Effective Board Management. So Stephanie is based in Spokane. Where are our Spokane peeps? Got a couple of you right there in the back, where she is an outsourced healthcare CFO and serves in Eide Bailly's OMS practice. Stephanie assisted in the development and implementation of strategic plans for rural healthcare entities, including critical access hospitals and physician-owned medical groups with ambulatory surgery centers, to grow margin by adding new patient service revenue, achieve patient-centered outcomes goals, and joint ventures with healthcare systems and other groups to achieve success. Martin is a senior manager with Eide Bailly's Assurance Healthcare practice based in Seattle. Where are our Seattle peeps? Whoop, whoop. All right. Martin's dedicated his time in serving healthcare clients, including hospital and healthcare system, critical access hospitals, and emergency hospitals, clinics, skilled nursing facilities, lifelong plan community, blah, blah, blah. Martin also serves government and not-for-profit healthcare clients. So please welcome Stephanie and Martin to take it away on effective board management.
Thank you. Good morning. I was kind of hoping for the Pump Up the Jam song, as we arrived on the stage. And brought back a lot of memories for me. I actually was on the Wenatchee High School dance team back in the day. And if I close my eyes and think really hard, I probably could even remember some of the choreography to that song. But long time ago, very long time ago.
Awesome. Awesome. Okay, and I was actually, as you can probably tell, I was not born in this country. I was born in Bulgaria in the middle of the 1980s. And when we had the 80s team, that really brought me back home and brought some really good memories of, being a baby in Bulgaria in the 80s and 90s. One of the memories that I remember is electricity cutting out every day at 9 p.m. In my early childhood. I definitely don't recommend living in a socialist country. But anyway, we're here now. Looking forward to the topic. So we'll basically be speaking on board management and engagement. And in the beginning, I'll cover basically some basics between board and management. Just feel free. The material that we have will likely not take the full 60 minutes. So just feel free at any point, if you have any questions, just feel free to jump in. All right. With that, let's go over some of the main differences between management and board duties. So on the left-hand side, we kind of have what the board usually does. The board is responsible for the governance of the entity, the mission, vision, and values of the entity, and the board usually defines the mission and vision of the entity. The board usually focuses on the mid to long term of the entity, whereas the management usually focuses on the short to mid-term plan of the entity. And then the management also is responsible, the board also is responsible whenever there is either the CEO leaves, they're responsible for finding the next CEO or the next person in the C-suite. And then management, on the other hand, is responsible for the day-to-day, basically and basically they're responsible for the day-to-day, and they also report to the board.
Yeah, and I'll just kind of chime in here. Some things that are helpful, I think, to kind of make the lanes very clear for the board versus the operational C-suite leadership of the entity, referring back, from your bylaws, your operating agreement, and then what kind of tools do you have in place to make these lanes very clear? We call it a governance grid and definitely your financial authority policy. But the governance grid can be, very helpful. That defines these are the delegated authorities that management has. And it's, they're hiring staff, hire all the hiring and firing decisions, whereas the board is going to be just that higher level oversight. The board sometimes, this is helpful to refer to. Here's an example where you have a board, maybe their family member in a small rural community hospital had a bad experience at the hospital. They then tell the management team, you need to fire this person. They didn't treat my spouse or mom or whoever, like they should have. You can refer back to that governance grid. Note we have hiring and firing authority as the management's role, not the board's role. Those types of just clarify those things up front.
All right. And then when you think about the legal responsibilities of the board and management, they're largely very similar. And for the most part, we have the duty of care, right? We need to act with care. And for the most part, they essentially come down to don't do anything illegal, unethical, or any self-dealing, basically. And also management has the duty to follow the board whenever anything that the board says is legal, right? And then management cannot follow that when it's not legal.
Any book from you, Stephanie?
Yeah, I wanted to just talk a little bit about with the acting duty of loyalty, I guess is a good one to talk about. The act in the best interest of the organization and not personal. So again, thinking about a small, rural community hospital board and the characters that will volunteer and be board members. You might have the bank, a bank manager. You have small business owners, retired military, those types of maybe the owner of the um, building supply company. I'm thinking of an experience here. And so when they're making decisions about, a construction project and loans and banking relationships, that's just conflict of interest. Everyone has the conflict of interest policy and people also have to sign, if they think a conflict of interest might arise. But those are just some things to think about when you have the branch manager of the community bank as a board member, and now you're making decisions on where the banking relationship's going to go, right? Those can be issues that you need to be thinking about up front um, yet before you get into those decisions.
There you go. Okay. And then on the next slide, we have a couple of our first case studies of essentially how bad things can go when board doesn't exercise adequate oversight of management and management doesn't exercise, by management, we usually mean the C-suite, and the C-suite doesn't exercise adequate oversight of mid-management. The first, the first case study here is Tenet Healthcare, which is one of the largest for-profit healthcare systems in the United States. Between 1992 and 2002, in a period of 10 years, one medical center that was owned by Tenet Healthcare, Reading Medical Center, was essentially, there were hundreds of medically unnecessary invasive heart surgeries. And that essentially led to a settlement with Tenet Healthcare, where Tenet had to pay $500 million of penalties and fees. And then essentially they had to divest the hospital as well. And when something like this happens at that scale, we often should ask ourselves, okay, how did things get that bad? And obviously the first item is the board oversight was not there. Reading Medical Center was the most profitable hospital that had in the state by a wide margin, and most of the profits were coming from a single service line, right? So those things should be raising red flags, where either the management nor the board, either they didn't see that and they should have seen that, or they saw that and they looked the other way. The second case study is a company here that's based in Seattle, Washington, that's near that we're very proud of in Washington State. And most of the issues for Boeing really started with the merger with McDonnell Douglas that was finalized in 1997. Prior to the merger, Boeing was always based in Seattle, Washington, and most of the people at the leadership of Boeing were basically not business people, right? That there were people that were kind of more, it would do to the culture of Boeing. When the merger happened in 1997, shortly thereafter, the headquarters of Boeing were moved to Chicago in 2001, and then subsequently they were moved to Arlington in 2022. And then subsequent to the merger, most of the C-suite was dominated by employees that were formerly with McDonnell Douglas, and the culture at McDonnell Douglas was very much cutting costs and making sure that we are happy with Wall Street. And basically, we all know that Boeing has been in the spotlight with multiple issues with quality and so on and so forth over the last few years. And essentially what's that led to that separation of the board and management from the company, basically not adequate oversight, and basically the focus has not been on quality. That has led essentially, if we think about the comparison between Airbus and Boeing over the last 25 years, Airbus became a public company in 2000, and the market cap of Airbus was approximately 20 billion at the time. The market cap of Boeing was approximately 3 times that, approximately 60 billion. Since then, the market cap of Airbus as of late last week was 157 billion, so near eightfold jump in market cap with Airbus, whereas the market cap of Boeing was 171 billion at the end of last week. And then if we think about the aircraft that Boeing put out in 2000 was approximately 490, whereas Airbus had 311 aircraft in 2000. As both in 2025, Airbus had 793, and Boeing 600. So essentially, a European company, as Europeans, we're not known for efficiency. We love our unions. We love to essentially kind of have a 5-day, 40-hour work week. This European company is more efficient, more profitable than Boeing has been over the last 25 years because they've been focused on quality and not focused on Wall Street, essentially. Anything to
Nothing
add?
to add on this one.
Okay. All right. All right. So moving on, what types of boards do we have? So typically there's probably 3 types of boards. The for-profit board, that's usually run by the owners or the founders of the company. That's usually the CEO. And usually there's representation from the stockholders because they're the owners of the entity. And then nonprofit and government boards, they're largely similar. Most of the board members are volunteers that feel very passionate about the mission of the entity. I'd say there's nothing more beneficial than volunteering with them with a nonprofit. So if there's a nonprofit that you feel good about the mission, I highly recommend doing that. My wife and I, we love cats. We have a couple of cats at home, and my wife volunteers her time with a couple of feline entities in Seattle, Washington. Luckily, we always volunteer at a different time because if we both volunteer at the same time, we probably will be going back home with a cat every single time we go volunteer. And eventually, we will end up on Team 5 meals with the household that owns 4 cats. All right. So that's on the types of boards.
I'll just add on that one. So the for-profit boards, I work with a lot of physician-owned entities, medical groups, and ambulatory surgery centers. So that would be my most of my for-profit experience. And I would just say that those are probably a nice way to put this, the most colorful board meetings I've ever attended, I would say. And it can get lively for sure. So again, having the clear separation and guidelines for people. Nonprofit has mostly been the hospital experience and foundation experience raising funds for the hospital. But even this week, I have a joint venture meeting. It's both I represent the medical group side of the equation, and I'm helping with negotiations for the joint venture board. So lots of different, different focuses. And where the representation and the backgrounds of all the either volunteer members or owners involved.
All right. And then when we think about boards, what we typically see on boards is there's usually a board chair that's kind of the basically the president of the board. There's a vice chair that's there when the chair is not available. There's usually a secretary that keeps meetings, that gives notice of meetings, and so on and so forth. And usually, when we think about the CEO, as we mentioned, the CEO usually has a pretty active role in the for-profit boards. In nonprofit and government boards, they usually part of the meetings, but for the most part, they're non-voting member. And they're what's called usually an ex officio member, which means by virtue of their office. So they will be part of the board so long as they serve as the CEO of the entity. If they were not the CEO, they would not be part of the board. And again, they're typically non-voting, and typically they serve as a liaison between the entity and the board. They're kind of the bridge that should connect the board to the entity and your management and so on and so forth.
And with the physician-owned groups, they typically will elect a president, vice president among their peers. They're all owners, but they take turns in serving in the officer roles, and that helps to keep things moving forward and not just always one perspective of one position driving everything. They rotate with the term limits. So just a little bit of a different structure there. And then often the CEO might actually serve as the secretary in that case. Board committees. So yeah, I had finance committee on Tuesday night, so I missed a party. But we had a finance and real estate committee. So that's not listed on here, but with the position-owned groups, often they also have separate real estate entities or their own the buildings that they're renting and occupying. So that was Tuesday night this week. Definitely on the hospital experience, always an audit committee, governance and compensation. Compensation committee, the hospital experience, pretty much every role as far as staff went were in unions. And so there wasn't need or a lot of focus on a compensation committee other than reviewing the key management in individuals. That would have been the only focus there. Other committees that I just want to mention, I think I talked about this at a presentation a little bit last fall, is um, patient experience advisory committee might be something that's not as common out there, but my hospital experience was at a Plain Tree Patient Center Care. And so there was actually a lot of activity around having patients that were maybe part of focus groups come back and serve on an advisory committee, work very closely with the board members. The hospital volunteer board members would participate also on the patient experience committees, and their role was to look at things like patient portal. What are the billing statements? What's my experience when I go through your phone tree and try to schedule an appointment? Those are always very lively topics. Get your patients involved. But what helped about having that committee was really grew the volunteer programs for the hospital, because often they would serve on that patient advisory committee, but then they would also volunteer in the gift shop or with pet therapy or other volunteer roles that were available. So just lots of different makeup of the committees there. So strategies to manage and engage, um, diversity of the backgrounds. So making sure that there's an interview process in place when you're onboarding new board members, looking at staggered terms and term limits. I think that in the hospital setting, I found that sometimes the people would serve on multiple terms, 10 years, 20 years, and there's a good continuity in that. But it also doesn't always allow, the next generation to get involved in the hospital leadership. And so I think having those defined term limits and looking at where do you have that opportunity for some fresh perspectives to come in and mix up that, make sure you're representing the different industries that are important in that population in that community. And again, inviting your patients to participate through the committee side of things, not the actual board itself. I think this kind of the agenda, the board packets, this was always something in the hospital that, the deadlines could never move. You had to have things a week in advance. The budget had to be 2 weeks in advance. The deadlines were hard deadlines, maybe because we had some military participation on that board, but they were very, you had to just whatever it took to get those packets out on time was really critical, and those volunteer board members really spent time going through that before the board meeting. Physician boards has been a whole different experience. You email them their stuff, they don't read it, they show up unprepared. Not all of them. There's a few that go through it with the tooth comb, but something that we found more successful with the physician groups is having their packets available to them in a folder, a reminder with the governance grid right there on top. Before you start the meeting, here's your role, here's your information. We give them decision summaries and discussion summaries, we call it, so they know every agenda topic. Is this just something we're going to discuss at the board meeting, and here's the backup behind what we're going to discuss? Here's a decision we have to make. We have to take action on these items, and what's the packet behind that? So we make it very clear to try to help them prepare for those meetings. Of course, taking minutes so that everything's tracked. Um, Another thing that I found with the different boards is again, maybe that's some of that military or government background is very strict, some Robert's Rules of Order, exactly how the meeting has to run, where debate has to take place, how long can debate be, is it timed, and following, that kind of a line. Others are very much more casual. We have votes, but there's, not the strict rules about like Robert's rules about debate and that sort of thing. So I think to relate to the presentation yesterday, I think Steve talked a lot about um, the story, and CFOs being storytellers. So making sure that you're designing your materials around that discussion and engagement, and reminding that connection of the mission. So it's not just 40 pages of data that isn't meaningful and uh, isn't the best use of everybody's time. Strategies to manage and engage board members. I think both in the hospital setting and the physician setting, I think, sending those updates and emails or other ways in between meetings is helpful so that not everything is a surprise at the meeting. Um, Making sure that you're engaging those board members in that meaningful work. Again, the hospital example, like we had a board member that owned a small business. She was also an artist. She was very passionate about integrated therapies. And so she participated on some of those patient experience committees, helped implement integrative therapies to improve the patient experience in hospital. Also enjoyed working with the patient advisory council. So really learning, what are the passions of the different board members and helping them get connected and involved uh, with that, with what really helps them to feel that they're moving forward that mission in the community, getting to know what they care about most. On the physician side, a lot of times physicians have gone, they went to medical school, they didn't go to business, they didn't go to a leadership school necessarily. Some do, some don't. But they don't necessarily understand all the operations of the business. So what we have found super helpful there is we have a physician champion that's assigned to each um, operations leader. So each director of IT, director of, the surgery center, director of operations, they're paired up with a physician champion, and they spend time outside of the committee meetings or the board meeting to talk about what's important to that operations leader. What kind of challenges are they dealing with? What kind of data are they looking at to manage the company? Can you get that one-on-one time with that physician champion to really help them understand the inner workings at the business side? Um, and so that has been actually really successful, because then when we come back into the board meeting, the physicians have a much better understanding of what's going on. And it kind of eliminates that us versus them mentality of administration versus the owners. It kind of brings everybody together more as a team, understanding what the challenges are. How do we all move forward together? So that has been really a positive thing. Common pitfalls, again, the overloading with too much information, um, and only engaging when you need something or you need action taken. I think, the best approach is really to be very direct and transparent. The pitfalls that I've seen over the years are when leaders or CFOs or CEOs tell the board what they think the board wants to hear, rather than the hard facts, the truth, the challenges, and bring them in on helping to problem solve. I think there can sometimes be too much of, we got this, don't worry, and instead of working through to the solution together. Go ahead.
I actually had a board meeting a year or so ago, and unfortunately, it's a small critical access hospital that financially was not doing very well. And I would say that most of the board really wasn't aware that they only kept 10 days cash on hand, and they didn't know if they'll pay next payroll. And I feel like that, right, that's something that sounds, right, how could that be the case, right? So just making sure that everybody in the board really knows what's happening in the entity, what the financials say, the song was very, very good.
I think for board education, so we have kind of a few different areas here. We'll talk about financial, and is one, budgeting and strategic, different types of education. So I think the point here is provide your board members with opportunities for education. Is there an actual onboarding program? Is there some training provided? Do you set them aside and have some basic financial, training if they don't come from a financial background? Those things are definitely recommended. These are just some example questions that I think it's helpful for a board member to have. Maybe in that folder, like with the physicians and their governance grid, these are the questions I should be asking. These are help keep their minds focused on their role and what they should be asking themselves as they're getting up to speed on being a board member.
And then I can cover this part also. What I've noticed usually on board presentations, that's something that Steve mentioned yesterday as well. A lot of the board presentations that I attend, they focus very heavily on the balance sheet and income statement and the differences of budget to actual, but they just don't really go into the cash flows. And there's plenty of entities that can be profitable on paper, but that could have issues with cash flow management. And I think one of the things that I get very happy when I see is ratios, right? Because ratios are so helpful. Because when you look at the cash line item on the balance sheet and you say that, oh, cash increased by 10 million from the prior year, that sounds really good. But is that good? It could be. It may not be the case, right? Because the days cash on hand, while the cash as a balance might have gone up by 10 million, if our expenses more than doubled in that same period, the days cash on hand will actually be worse off than it used to be. And there may be valid reasons for that, right? Maybe we opened a second hospital and maybe we're ramping up the second location, and expenses always ramp up faster than revenue does, right? It takes time for people to kind of learn about new hospital and so on and so forth. So just making sure that when we present financial information, we're telling a story, as you mentioned yesterday, and making sure that we're explaining what the ratios mean. I think we as CPAs, I think most of us have some background in finance. And when we look at the financial statements, we generally kind of see a story, but that's not what people that are not CPAs or don't have background in finance see. And just helping them see that story, helping them kind of make sure that they know what the numbers and the ratios are saying and so on and so forth. Something that's really important as well is to really know what the sources and uses of cash are and the timing of cash outflows and inflows. And then when you have budget to actual differences, just realizing, okay, are these differences that are permanent or are these timing differences? I think when most of us were working on budgets last fall, we probably did not think that we'll be sitting here in April and gas prices will be $6 per gallon, which essentially would make everything else more expensive as well. And I think somebody mentioned yesterday in the 340B, most of the drugs that we get in the US come to the US from India, right? And so either way, that's probably going to be more expensive. But we all know that with 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 everything that's happening, everything gets more expensive. And whether you fly the drugs into the US, that's still more expensive and so on and so forth. Just making sure that when we look at budget actual, we don't just look at the differences, but we know why a difference is happening. Are these differences because we didn't budget right? Or are these differences because something is happening outside of the walls of the entity that we didn't know was going to happen and we don't have any control over? Is there anything you that
Yeah, I just would add, I would reiterate that, I do have a lot of groups that have a tendency to just want to focus on the profit and loss statement. And that's where all their attention goes, and they rarely look at the balance sheet or a cash flow or a cash flow projection. So just make sure that with the packets that you're preparing and presenting to boards, whether it's hospital board or physician-owned board, that there's a sufficient amount of time also dedicated to cash, and cash projection and a cash flow budget even. I rarely see people do to budget with their cash flow projections. But I've run into here's an example of where cash wasn't being paid attention to in a physician group. They were only looking at their P&L. They had the P&L flow through for their physician compensation model. The owners paid themselves basically, based on what was happening in the profit and loss statement. And oopsie, we forgot to also include cash impact items from the balance sheet. So capital assets, would be a common example. And so they actually overpaid themselves and couldn't figure out why they were negative in their cash flow. Well, we need to also, do the non-P&L transactions, cash flow transactions here, and make sure that we make a cash line item, balance sheet cash changes should be part of that reconciliation in their compensation model. So
All right. I would say the other thing that I see as a very common pitfall in budgeting is most of the smaller clients that I work with, budgeting is kind of a function in accounting and finance. I don't think they have any from other departments. They don't top housekeeping, maintenance, purchasing, so on and so forth. And I think that's something that's really shouldn't be happening. It shouldn't be where the CFO or whoever might be in the accounting office is taking the results of the prior year, inflating them by a percentage point, and oh voila, that's the budget that we have for next year. That really shouldn't be the case. It's not very helpful, not very thoughtful, and basically it's not.
is it a regurgitation of previous years, or is it really, where our goal and where we want to head? That's always something to think about.
And then last but not least, we definitely want to make sure that when you have new board members, they know what they're supposed to do. If there's any, legal issues or so on and so forth, what they can and cannot do as board members, and so on and so forth. And then we also want them to know that there's tax filings that the entities are responsible for, right? Most entities that are non-profit or for-profit, all of them have to file tax forms. Not so much if you're a government entity, unless you have UBI financial statements. Those audits are generally due every year. And then if there's any debt, there's often debt covenants that are also based on the audited financial statements results. So making sure that everybody on the board knows what the legal expectations and requirements are when you sort of.
Nothing to add on that one. What are the next? So we'll get into just a little bit more on strategic planning. I think it was, John that was talking yesterday about, a construction project and engaging an architect first without a plan. I think I've run into that same situation. So for board education, I think strategic planning is a big part of this process and should be done annually. I think if there's not a lot of change expected, but I think in healthcare, there's always a lot of change expected. And so I think even just refreshing your strategic plan each year is a good idea to keep it a live document that's embedded in your day-to-day operations. Go ahead and switch to the next slide. The strategic plan back in my hospital days, I can actually remember, I can see the physical paper strategic plan in a big fat white binder that would sit on the shelf in the CEO's office, for a strategic plan for these 3 years. And then I think there was a lot of time and energy that created this physical paper document, and then nobody looked at it. It wasn't operationalized. It would sit there, and then 3 years later, oh, did we get any of that stuff done? Maybe, maybe not. So go on to the next. So really, having the retreat, having some team building time built in. I know at the hospital board, I think we had a little golf scramble or something to kind of warm everybody up, an event. And then it's nice to have a place off-site so they're not just sitting in the same board meeting room, conference room that they always sit in. Get people in a little bit more of a casual environment for that team building, get to know each other, revisit that mission, vision, and values. Is that still the mission, vision, and values? Do they need edits? Do we need a committee to work on? Maybe updating it. Is it from 20 years ago and it's not us anymore? It's not what you want to present. Looking at refreshed market data, again, making decisions with data, not just here's what we want to do or what we think, but what is happening in the market? What do we project happening in the market? What are our strengths, weaknesses, opportunities, and threats? And then what do we want to do for the next 3 to 5 years? Connecting it with the budget. A lot of times I also see the strategic plan is a document and a workflow over here. The budget is a separate document or workflow over here, and they're not connected. So if you are not connecting the two and making sure that you're budgeting and aligning with those goals, likelihood of achievement is pretty low. and then operationalizing all of those strategic plan goals so that they're part of every committee meeting, operations council meetings. We have on our agenda, even here's our top 3 strategic plan goals, and underneath those, these are the agenda items that we're going to talk about today, and here's how those agenda items are connected to our high level strategy. Always keeping that connection and those reminders at every single meeting. Key conference attendance, I mentioned. Some board members, again, how do you engage them? And some experience I had with hospital board members is actually at having board members attend hfma, having them attend the Plain Tree Patient Centered Experience Conference, that was their passion. Giving them, not just your managers, but board members, those opportunities to really learn about what's going on and be part of, again, that solution. Is again the strategic plan actionable? Are we monitoring the implementation? What is our progress on the goals? And routine visibility into that. At the hospital, we used to even have on the TVs in the break rooms, there would be some slides about here's our mission, here's our high level strategy. You could see, the Gantt charts of what's our progress on some of these things. Visual for the staff, so they're also engaged in the strategy and how the organization's moving forward. Next slide. So just to kind of sum it up here, time management of the board. So if you have, I would say, the three smaller slices of the pie here under control, the risk management, the cash flow, um, and the controls in place, so that that part is functioning sneakily, then ideally you're spending the majority of the pie on your strategy and the bigger picture and where do we go from here. But what we commonly run into, Martin and I both, is that, cash flow takes up all of your time and energy in board meetings, and you don't even have time to, get back to the strategy to how are we going to fix it, and what can we do differently to move forward. So this is the goal, to have more time on the strategy and not be caught up in the regulatory, the risk, and the cash flow. Any questions that anybody has for Martin or I? Or we were also thinking it would be fun to hear some board experiences. If anybody in the room would like to share a board experience with us.
Okay. So the question has to do with when the board has to make a decision to exit the CEO of the company, and how the board interfaces with the constituents that maybe love the CEO or the employees that love the CEO, when there's certain information that can be disclosed and not disclosed related to the exit of the CEO, and how that transition from the communication to then the interim, and then where the interim starts taking the lead on the communication to ensure that transition process is successful.
Yeah, I would say this is a tough one because it's such a touchy subject when things, don't go well. And you often can't disclose, the details of why, somebody is leaving, legally, you can't. But you can try to I always say you can never over communicate. But try to over communicate, this is the plan, this is the interim, this is how we're moving forward, at least temporarily. Maybe we don't know the exact timeline, but lots of updates. I think you can never over communicate, at least those facts that you are allowed to share over and over and over again. And people will have questions. Well, when is it happening and why? And often you have to say, we can't disclose all the details, but we're here's the action plan, here's where we're headed. We have good people to help support us, and reassuring. That would just be my experience in some of those awkward situations. Martin, did you have anything?
I would definitely say, I would definitely second that. And I have signed up for Becker emails, and I think we all probably all have those every day. And I've definitely seen instances where you would see news that the hospital so and so decided to move away from the CEO, and then the CEO will release a statement that sounds pretty bitter. So I think just being proactive and just making sure that the CEO themselves also know it's not a surprise to them where it does cause a reaction that might be kind of, kind of more negative. Is making sure that all the parties involved know why something is happening. And as Stephanie said, sometimes you can't really disclose too much because that obviously has some legal implications. And there's nothing more we love in the United States than suing each other and suing our funds. So just making sure that, you speak to lawyers and so on and so forth. But I definitely seen, and this is public information, but I saw there was a board in a public hospital district in Washington that voted to remove the CEO. And then the employees got really upset, entered the meeting, and basically caused the board to reverse that, and then essentially forced the two board members that had colluded to make the CEO to make the board fire the CEO leave. So that's something that when you see those news, it's kind of a story of, oh, the employees really care for the CEO, but also is a story of, well, did the board know what they were doing? And kind of doesn't give you, if you live in that area, that doesn't give you the comfort of, oh, the board really is thinking about the next 3, 4, or 5 years. It seems like a reactive issue, not proactive. Yeah, it's a very touchy subject, basically.
Robert Rules of Order might have come in handy in that situation because there are some suggestions in there about revisiting a decision that was already just made. Something to look up. Any other stories, board situations?
Well, I can think of another public story of a client that I work with that's not based in Washington. I don't want to disclose too much details, but the hospital it's a large health system, and they recently, in the last 2 or 3 years, opened a new location, and they really funded most of that new location with cash flow that they had they didn't borrow. And that kind of led to, they were basically on the brink of kind of not making payroll. Essentially, they were down to a place where they had 20 days cash on hand. And there was an instance where the CFO or the former CFO had decided that they cannot be independent. They had decided to go and talk to other health systems for potential affiliation. And he only made the board aware of that when he had some health systems that were potentially looking to affiliate with the health system. And the board was not there. The board did not think that had to happen. And they felt like the CFO acted behind their back. And they ended up dismissing the CFO. So that's something, right? It's not just the board. Management also has the responsibility to be proactive and to make sure that they don't do something that the board doesn't like. Basically.
And acting as a team and working together towards a solution. Any other examples anybody would like to share or questions that you have for us? All right. Thank you so much. We've enjoyed spending time with you all this week.